Okay, so Dr. Chimdi, today in the office, somebody ran in and came to meet me, and he said he showed me a message that is trending, and it says the Ministry of Health's emergency notification to the public that coronavirus influenza outbreak this time is very serious and fatal, and it says prevention method is to keep your throat moist. Do not let your throat dry up. Thus, do not hold your thirst before once your membrane in your throat is dried. The virus will invade your body within 10 minutes. It says you should drink 50 to 80 cc warm water, 30 to 50 cc for kids according to age. And he just kept on writing. And this is trending now. And this is because of this coronavirus that is going on. And is there any truth in this?
You know, whenever there is an outbreak of disease, a lot of people come down with a lot of things, come down with a lot of suggestions, and everybody wants to get to social media in this era of social media to put out information out there. We remember the Ebola time,
yes,
when we had people talk about salt
at 5 a.m. in the morning and
all that as part of informations that are out there. People actually started following that. Coronavirus, it's just an epidemic that just started recently. It's been in and out, and the current one just started in China. Wuhan, and it's a respiratory tract infection that had now spread to a number of other countries like Thailand. There are already reported cases in France and US, United States of America, and some other Western countries. And because the world is now a global village, so there's a lot. It's very easy to move from one country to the next and all that. So all we all need to do is to look out for how to prevent it. These are infections that started from animals, rodents, and in this particular environment. And for us, and how it affects us as Nigerians, is that prevention is still the very best. There are a lot of trainings and drills going on in town because Nigeria and China have a lot of trade deals, and we have a lot of them coming in here, and a lot of our Nigerians visit China at different points. So it's something that we as Nigerians have to be ready about. And then being an infection that it affects the respiratory tract, the prevention, it's still making sure that we don't have contact with the droplets of an infected person.
That's from cough, somebody was coughed and
sneezing, talking, exposures to that, and then also not having body contact with someone who had been exposed to coronavirus. And how do we do that? Make sure that we clean our hands. You know, the other day I was thinking through how the habit of greeting is just handshake and all that. Yes, it could be a formal greeting, but from the health point of view, there are not just beyond coronavirus. There could be a lot of things that we can actually spread through handshake. So as much as possible, we should clean our hands, wash our hands, or use of hand sanitizers at all times. And then in areas that are crowded, we shouldn't visit such places at this time, because for now there is no yet record of coronavirus in Nigeria, but being a global village, and we have a lot of Chinese in Nigeria who traveled back because they just went for their New Year festival, and a number of them will be expected back soon. Everybody is at risk. What I'm aware the federal government have done is that they've already stationed quarantine stations in all the international airports, preparing for the return of these Chinese. You will not say ban anybody coming into your country, but you have to quarantine and observe and make sure that they don't get to the general public without good screening. So in taking care of that is that we should cover and not have contact with droplets
okay.
of an infected person,
Okay.
not physical contact through the hands or any other thing with an infected person, making sure that any body fluids as well for the healthcare worker or any other person who comes in contact with the body fluids of an infected person will be at risk. So hand washing for coronavirus and any other, it's very vital.
So this whole story of drinking water doesn't have any. You can drink water.
You can drink water, hydrate yourself, and all that.
But that's not the prevention.
That is not the prevention. The prevention is contact, droplets, cough, any sneezing, body fluids, physical contact as the prevention.
Thank you very much for that information.